So I think one of the things that's really important about exposure to environmental pollution is that it is, first of all, we're all exposed, as you heard from Shauna, a little bit from Leo, from all the biomonitoring studies, from the air pollution studies. You cannot avoid exposures to these chemicals. So the first thing I think also is important to remember about this is that sometimes, and people ask me for advice all the time about what should we do, and there are things you can do, but you have to remember it's not your fault because these chemicals are being produced and put out, and they're basically mostly unregulated. And there are populations who have higher exposures either because they live near polluting facilities, and many people live near these polluting facilities, including low-income communities, Black and Hispanic communities. And this is well documented in multiple studies across the United States. Some of the data from EPA that they put out about air pollution, or data that California puts out about where facilities are located. And it's not just facilities, it's also, do you live near a freeway? And do you live near a or a highly contaminated site? So we know that those populations live closer to these facilities, and there's also populations that have higher rates of disease, including, so this, which we refer to in the medical field or health field as health inequities, meaning there are higher rates of preterm birth, higher rates of low birth weight among, for example, Black populations. And even in some places, what we're seeing now in terms of the trends you're talking about, in terms of concerning trends, is, for example, an increase in maternal mortality. Like, women who have babies should not be dying in the United States, and yet you're seeing that going up, particularly in Black populations, in locations that are both underserved and have higher pollution levels.